What is going on, everybody? It's Medicosis Perfect Natus, where medicine makes perfect sense. Let's continue our microbiology playlist. Today is video number 4. In previous videos, we had an introduction about microbiology. We discussed the difference between gram-positive versus gram-negative and the gram stain technique. We talked about the gram-positives, and today we'll dig deeper into one of those gram-positive cocci known as Staphylococcus aureus. Today we'll talk about their characteristics. In the next video we'll talk about the diseases caused by Staph aureus. As you know, Staph aureus are gram-positive cocci in clusters like grapes, and if you are gram-positive you will be purple. Please watch these videos in order for maximum retention. Microbes are either bacteria, fungi, viruses, and parasites. Viruses are not living organisms. That's why the technical name is not a microbe. A virus is a particle. Ergo, microbiology deals with bacteriology, fungology or mycology, virology, and parasitology. When I say Staphylococcus aureus, Staph is the genus, aureus is the species. Let's talk about these bacteria. Using the gram stain, they are either gram-positive or gram-negative. If you're gram-positive, you're purple. If you're gram-negative, you're pink. If you want to know why purple and why pink, watch my previous videos, please. Staph aureus is a gram-positive. Okay, is it a gram-positive coccus or bacillus? It's a coccus, spherical in shape. Staphylococcus aureus is gram-positive coccus. And then what? Is it catalase positive or catalase negative? All the staphs are catalase positives. All the strepts are catalase negatives. Gram-positive bacteria are either cocci or bacilli. If you are a gram-positive coccus, let's look at your catalase. Do you have catalase or do you not have catalase? If you have catalase, you're catalase positive. Example, staphylococci. And then, what kind of staphylococci? What's the species? Well, it depends on the coagulase. Do you have coagulase or not? If you do have coagulase, congratulations, you are Staphylococcus aureus. If you do not, you're either Staphylococcus epidermidis or Staphylococcus saprophyticus. How do I tell? Novobiocin. Are they sensitive to this antibiotic or are they resistant to this antibiotic? If they are sensitive, which means destroyed by this antibiotic, congratulations, you are Staph epidermidis. If you are resistant to it, if this antibiotic does not kill you, then you are Staphylococcus saprophyticus. All the organisms in this lovely slide are gram-positive, spherical, lacking endospores. Today's video will talk about the microbiology or the characteristics of Staph aureus. In the next video, we'll talk about the infectious diseases, internal medicine stuff, caused by Staph aureus. And boy, do we have some interesting stories coming. Let's organize today's video. Let's get oriented. In the beginning, we'll talk about introduction and then the capsule of the bacteria, followed by the cell wall. Dig deeper, cell membrane, and the virulence factors of Staph aureus. And then we will summarize. In introduction, we'll talk about the nomenclature and the classification of Staph aureus. Then we'll talk about the capsule. I'll tell you, structurally, the capsule is polysaccharide. Saccharide means sugar. Oh, lots of sugar, carbohydrate that is. Yeah, functionally speaking, the capsule inhibits phagocytosis by your own immune cells. And this is one of the ways the bacteria can evade your immune system. Next, we have the slime layer, or what I call the slimy layer. It's a biofilm. This is the airport security. Why? I'll tell you. Because these patients have prosthetics. What do you mean? Artificial. What do you mean? Artificial limbs, artificial joints, artificial heart valves, etc. Oh, that's why they get stopped at the airport all the time and they cannot do an MRI. Oh, I see. Therefore, if you have these prosthetic devices, you might have introduced bacteria into your blood. Oh, and these bacteria love to adhere to these artificial prosthetics using their slimy layer. Let's dig deeper. A thick cell wall. Why thick? Because this is gram-positive. Structurally speaking, the cell wall is peptidoglycan. What do you mean? Peptide side chain. Okay, what's the backbone? Sugar. So the main thing is sugar, just like the capsule. That's the backbone. And then we have peptide side chain. How do you link the backbone with the side chain? Transpeptidase. That's why it's called peptidoglycan. Don't forget that the wall has teichoic acid. Functionally speaking, peptidoglycan provides rigid support for the Staph aureus. It also prevents osmotic damage. Dig deeper. Cell membrane. What's that? Like any membrane. Phospholipid bilayer. Okay, I have lipids. What else? You have carbs. What else? You have proteins, including the famous penicillin binding protein. This is where the antibiotic penicillin binds to and destroys the bacteria by binding here. And don't forget that your enzymes are proteins. Even the bacterial enzymes are proteins too. These enzymes are important for oxidative reactions, and these enzymes are important to synthesize peptidoglycan. The cell membrane does not have teichoic acid. The cell membrane is full of fat, lipid bilayer, therefore lipoteichoic acid. Big difference. The cell membrane has those enzymes and they act as anchoring proteins. Of course, cell membrane also protects the bacteria against osmotic damage. Why is Staph aureus dangerous to you, aka virulence factors? Because of structural components, the structure of the bacteria, because of toxins produced by the bacteria, and because of bacterial enzymes. If you want this video to make sense, bring a blank piece of paper and write this down. Virulence factors are three things: structural components, toxins, bacterial enzymes. Tell me more about the structural components. You have the capsule, you have the slimy layer, you have peptidoglycan, cell wall, teichoic acid of the cell wall, protein A, aka staphylococcal protein A. Thank you. Toxins. We have cytotoxins, exfoliative toxins, enterotoxins, and toxic shock syndrome toxin number 1. Bacterial enzymes. You have the famous coagulase. Don't forget, Staph aureus is coagulase positive. That's how it's able to be localized in one area, causing an abscess. Oh, that's a localized skin lesion. True, because it's coagulase positive. Next, hyaluronidase, fibrinolysin, aka staphylokinase, lipase, nuclease. Let's dig even deeper. The virulence factors are bacterial structural components, bacterial toxins, bacterial enzymes. The Staph aureus has the capsule, which is made of polysaccharide, and it inhibits phagocytosis. The slimy layer helps the bacteria adhere to artificial prosthetic devices, such as valves, artificial limbs, artificial joints, catheters, grafts, shunts, etc. Then the peptidoglycan in the cell wall, sugar backbone, peptide side chain, linked together by transpeptidase cross-linking. Functions of the peptidoglycan: pyrogenes production. What the flip is that? The word pyro means heat, because remember, what's the type of glass that you can put in the oven without breaking it? It's called Pyrex. Yeah. Why do they call it that? Because pyro means heat. Oh, really? Yes, really. These pyrogens are endogenous. They have endotoxin-like activity. They have interleukin-1. They recruit neutrophils. Neutrophils are responsible for what? Acute inflammation, redness, hotness, swelling, pain, loss of function. Redness, hotness, swelling, pain, loss of function. Ruber-Kaller tumor, dollar function, let's say. Peptidoglycan provides a surface for adhesion proteins. We'll talk about them very soon. Peptidoglycan protects the bacteria against osmotic damage. It also prevents phagocytosis. Peptidoglycan has two N's, N-acetylmuramic acid and N-acetylglucosamine. The N-acetylmuramic acid provides a surface for the attachment of oligopeptides. It also cross-links via peptide bridges, not to be confused with your yoga bridges. Next, we have teichoic acid we talked about in the previous video. Remember, it is specific for the species. It is species specific. It's a polymer. It contains phosphates of the P and the P. It forms a covalent bond with this doofus right here. It also binds fibronectin. Next, staphylococcal protein A arrests the antibodies. It stops your antibodies. Oh, I get it. So it protects the bacteria. Well, no duh. That's why it's a virulence factor. This is why Staph aureus is so toxic, like your relationships. Next, staph toxins. We have cytotoxin, exfoliative toxins, enterotoxins, and toxic shock syndrome toxin number 1. Let's start by cytotoxins. You have alpha, beta, gamma, delta, and PV. Exfoliative toxins. It's either exfoliative toxin A, or exfoliative toxin B. The A is heat stable, but the B is heat labile. The A is phage, the B is plasmid. What does exfoliation mean? Well, it means removal of your skin. Oh, really? Yeah. Do you think Staph aureus is going to cause skin disease? Yeah. That's why Staph aureus can cause staphylococcal scalded skin syndrome, or SSSS. Next, staph enterotoxins. The word entero means what? Intestines, guts, bowels. That's why staph can cause food poisoning. We have two types of this, type A and type B. Don't forget, these enterotoxins are super antigens, therefore they will cause a super strong immune reaction. And you will spend the rest of the day at the toilet. We have two types of enterotoxins, A and B. A is responsible for watery diarrhea. That's the food poisoning caused by staph. Especially if you eat potato salad that has been left at room temperature for a long time. Also banana pudding, custard, ice cream, pastries, salted pork, ham, etc. Enterotoxin B is bowel. Did you know that Staph aureus can cause pseudomembranous colitis? I did not say that this is more common than Clostridium difficile pseudomembranous colitis, but it does exist. Next, bacterial enzymes. Coagulase. Why? To coagulate. What do you mean? To convert fibrinogen into fibrin. Oh, that's why Staph aureus is localized in a teeny tiny space on your skin. Folliculitis, abscess, furuncle, carbuncle, impetigo, very teeny tiny localized stuff. Unlike streptococci, because they are coagulase negative. That's why streptococci can cause sepsis, cellulitis, necrotizing fasciitis, erysipelas. Widespread, not localized. Big difference. Staph aureus has hyaluronidase. Why? For the hydrolysis of the hyaluronic acid. Your hyaluronic acid, that is. And that's why they can spread into deep fascia. Oh, do you remember carbuncle? Yeah, it can cause bacteremia. How come? Hyaluronidase action. The stinking Staph aureus keeps digging into your skin and digging into your subcutaneous tissue and digging into your deep fascia. Before you know it, it's in the blood. Before you know it, you have the signs of bacteremia. Next, fibrinolysin or staphylokinase. Fibrinolysin, let's break down the fibrin. That's how Staph aureus can cause bacteremia. Lipase to break down lipids, and that's how Staph aureus spreads through your superficial fascia. Superficial fascia via lipase, but spread in deep fascia via hyaluronidase. Last, we have nuclease to break down your DNA in your nucleus. Let's start on the outside and go deeper to the inside. On the outside, you have the capsule. Polysaccharide inhibits phagocytosis. Boom, we're done. Under the capsule, we have the slimy layer, the biofilm. What's that? Monosaccharide. Sugar? Sure. And as you know, sugar sticks. Oh, it is very sticky. That's how they stick to your artificial prosthetics. They have some proteins, they have some small peptides, and if you have a protein that adheres, I'm going to call you adhesin, IN protein. That is adhesive. That was the structure. Function of the biofilm helps the staph adhere to artificial devices such as valves, artificial joints, shunts, grafts, catheters, etc. So after going through these procedures, Staph aureus can give you hell, and the doofuses at the airport can also give you hell. The doofuses at the hospital will refuse to do an MRI for you. Everything on this slide was discussed in the previous video. Just remember, if it's a gram-positive, it has a thicker wall with more layers. We have peptidoglycan, teichoic acid. Dig deeper, membrane, lipoteichoic acid, phospholipid bilayer, and we have some proteins such as the penicillin-binding proteins and the enzymes. The enzymes are for oxidative reactions and for the synthesis of the peptidoglycan. Gram-positive has a thicker cell wall as compared to gram-negative. Gram-positive has only one membrane versus gram-negative, which had an outer membrane and an inner membrane, and therefore a periplasm or periplasmic space between the two membranes, or you can call it intermembrane space. So we talked about the capsule, we talked about the slime layer. Now let's talk about the cell wall of the Staph aureus. Peptidoglycan, teichoic acid. Tell me about the peptidoglycan. sugar backbone, peptide side chain, linked together via transpeptidase cross-linking. What's the name of the chemical bond? Peptide bond. Okay, what's the function of peptidoglycan? Pyrogene production. Recruit neutrophils. Pyro means fever. Provide a surface for adhesive proteins or adhesion proteins. Protects against osmotic damage. Protects the bacteria from your phagocytic cells. Peptidoglycan has N-acetylglucosamine and N-acetylmuramic acid, which is a surface of attachment for oligopeptides. Next, we have the teichoic acid, species-specific. It's a polymer, contains phosphate, is covalently bound to this doofus right here. Now, what are these adhesion proteins? Structurally, they are proteins. Oh, well, you don't say. No kidding, Captain Obvious. They connect you to the bacteria. That was deep. What do you mean? These proteins will adhere to the bacterial peptidoglycan, and the same proteins will adhere to your tissue. What kind of tissue? Your fibronectin, your collagen, your elastin, or fibrinogen. Clinically speaking, they help us recognize the stupid Staph aureus, and that's why we call these adhesion proteins microbial. Okay, surface. Get it? Component recognizing adhesive matrix molecule. Dadgummit. Who named these things? Example, staphylococcal protein A. Okay. It adheres and arrests your antibodies. It binds to the Fc portion of your IgG immunoglobulin, preventing antibody-mediated clearance of the staph. Oh, my immunoglobulin or antibody, IgG, was trying to kill the Staph aureus, but the stupid staph protein A adhered to my IgG and stopped it from functioning. Absolutely. When you have an antigen antibody, what do you call it? Like an immune complex. True. And this can activate the complement. True. What pathway of the complement? The classical pathway, because it's an antigen antibody reaction. This will cause activation of your complement. You're using your complement. You're using your complement. You're consuming your complement. You can get hypocomplementemia because of a staph infection. Another adhesion protein is the fibronectin binding protein. It's a protein that binds to your fibronectin in your connective tissue. Third, clumping factor protein. We have A and B. By the way, clumping factor protein is the same thing as coagulase because it helps the Staph aureus clump and cling into a single tiny spot. Do you remember my physiology playlist, especially the section on immunology? Yeah, we talked about the functions of antigen-antibody complex. Haven't I told you that your body will try to neutralize the bacterial antigen? It will try to make it tasty so that we can eat it. It will try to agglutinate. It will try to activate your natural killer cell, which is innate immunity. It will try to activate the classical complement pathway, which is also innate immunity, but it's a bridge between innate and acquired. Haven't I told you all of this? Example, here is the stupid bacteria invading your body. You'll take a piece of it called the antigen, and then the antigen presenting cell is gonna present that antigen to your lymphocytes. For instance, the macrophage, one of the antigen presenting cells, can cling to an antibody, and this antibody is IgG, for example. It has a constant portion and a variable portion. The constant is called OC, FC. Oh, it's the fraction that is constant. I get it. Bacterial antigen plus your antibody equal antigen-antibody complex or immune complex. We call this agglutination. Before you know it, you're gonna phagocytose and eat the bacteria. But the Staph aureus can be tricky because of the staphylococcal protein A, which arrests your antibodies by binding to the Fc portion of your IgG. Here is the structure of the antibody again. Constant, variable. The constant is the Fc. This is the fraction that is inhibited by the staph protein A, which arrests your antibodies. Do you remember the complement system? We had three pathways: classical, alternative, lectin. Which one was triggered by the antigen-antibody complex? The classical pathway. This is the one that can be activated in case of staph infection. That's why you run the risk of consuming your complement and developing hypocomplementemia. Here is a wonderful slide summarizing the 3 complement pathways. Please watch my video called The Complement System. Pause and review. Why the flip do I need a complement system? Agglutination, bacterial opsonization, neutrophilic chemotaxis, direct cell killing. Your complement is very important for you. We talked about the capsule and the slimy layer. We talked about the cell wall. Let's talk about the cell membrane of Staph aureus. Structurally, like any membrane, lipid bilayer, phospholipid that is, plus carbohydrates, plus lipotecoic acid, plus some proteins, such as penicillin binding protein and enzymes. You need enzymes for anchoring, oxidative reactions, and to synthesize the cell wall peptidoglycan. Function: prevent osmotic damage. We are done with the bacterial structural components. Let's talk about the staph toxins. We have cytotoxins, exfoliative toxins, enterotoxins, and toxic shock syndrome toxin number 1. Pause and review. Don't forget the cell surface of the bacteria has adhesins, which help the bacteria adhere to your epithelium. And that's why staph can colonize my mucous membrane. You find Staph aureus, for example, in about 10 to 15% of the nasopharynx of the general population. That's why if you go to a restaurant and find the cook or the chef putting his finger in his nose, run for your life. You can get food poisoning here. What kind of food poisoning? Staph food poisoning. Then our lovely public health officials ordered every restaurant to tell their chefs to wear gloves while preparing food. So the stupid chef inserted his gloved finger into the same nostril. No difference whatsoever. Run as fast as you can. You can find staph in skin, nasopharynx, oropharynx, GI, GU, umbilical stump, perianal area in neonates. Do you remember coagulation? When you injure yourself, you need hemostasis, which includes vasoconstriction, then plated plug or primary hemostasis, then the coagulation cascade or secondary hemostasis, and then fibrinolysis. Here is the coagulation cascade or secondary hemostasis. Convert prothrombin into thrombin, fibrinogen into fibrin. Trap the red blood cell. Congratulations, you have a clot. Staph has an enzyme that converts fibrinogen to fibrin to make a clot. It's called coagulase. It's also known as clumping factor protein because it helps the Staph aureus clump itself, surround itself by fibrin fibers. Why is this useful for the bacteria? Because this helps the staph evade your immune system. The bacteria is literally hiding from you. Coagulase is an enzyme, ergo its protein. Function: converts fibrinogen into fibrin, which helps the staph aggregate. Types: we have 2 types of the coagulase, bound and free. The bound has direct action, free exerts indirect action. What do you mean by direct action? Adhesion protein. Oh, why is this? Because when you convert fibrinogen to fibrin, you are providing a surface for the proteins to covalently bind the peptidoglycan of the bacterial cell wall. The indirect action is by the free coagulase. This coagulase in the blood reacts with globulin plasma factor, which is a plasma protein in the plasma of the blood. 1 plus 2 equal 3, staphylothrombin. That's not your thrombin, that's the thrombin of the staph. Oh, I get it. It's a thrombin-like factor, just like your good old thrombin, which converted fibrinogen into fibrin. This will also convert fibrinogen into fibrin and will help the bacteria aggregate and hide from your immune system. Significance of the coagulase. Well, it has a function for the bacteria. It protects it from phagocytosis. Clinical significance. It helps the bacteria, staph, stay in one location and cause localized diseases such as folliculitis, abscess, blister, bullae, furuncle, carbuncle, impetigo, but not sepsis, cellulitis, necrotizing fasciitis, erysipelas. Why not? Because the bacteria has coagulase. It's going to stay in one location in most cases. In severe cases, it can dig itself deeper into your superficial fascia because of the lipase and deeper into your deep fascia because of the hyaluronidase, and before you know it, you get bacteremia. But this is mostly staph. This is mostly streptococcus infection. As we have discussed in previous videos, this is super important. Next, it helps the lovely pathologist in the lab identify the Staph aureus. In an upcoming video, I'll compile a list of mnemonics about Staph aureus for you, so stay tuned. We're done with the structural components. We're done with the toxins. Remember, cytotoxin, exfoliative toxin, enterotoxin, toxic shock syndrome toxin number 1. Pause and review. Let's talk about enzymes. Staph enzymes, part of virulent factors. Remember the coagulase. Oh yeah, I remember that. And we have others. There is an American comedian named Bill Burr from Boston. He used to make a lovely bit about him going to a shop to shop for bullets. And the shopkeeper was advising him about different kinds of weapons. And he said, no, you choose this weapon rather than this weapon because it's got a good spread. It's got a good spread. He kept saying this. It's got a good spread, man. Same thing with the Staph aureus. It's got a good spread. Why? Because of hyaluronidase, fibrinolysin, lipase, and nuclease. Hyaluronidase will help with the hydrolysis of your hyaluronic acid, which is in your connective tissue. Therefore, the bacteria will spread in the deep fascia. And before you know it, the furuncle became a carbuncle. The carbuncle kept digging deeper into my deep fascia at the back of my neck and on my back. And before I know it, there is a sinus tract deep in my skin, and you get bacteria. Next, fibrinolysis, dissolution of the fibrin clot. It's got a good spread. And then lipase, breakdown of your lipids in your superficial fascia. Good spread. And nuclease to break down the DNA. Staph versus strep. Staph has staphylococcus, but strep has streptokinase. When the doctor is looking for anti-streptokinase antibody, they're looking for the streptokinase of the streptococci. Staph has staphylothrombin because of the coagulase. Strep does not. Conversely, streptococci have streptolysin. We have streptolysin S and streptolysin O. Do you remember the anti-streptolysin O antibodies? Oh, rheumatic fever and post-streptococcal glomerulonephritis? You got it. This is only for streptococci, not for staph. Okay, and then we have an equivalence. Something similar, not identical but similar. Staph has nuclease, strep has DNase. Bacteria can use gazillion mechanisms to evade your immune system. We have talked about some of them before. Pause and review. Staph aureus is a gram-positive coccus in clusters, just like grapes. Staph aureus is coagulase positive. The other staphs are coagulase negative. In the next video, we'll talk about diseases caused by Staph aureus. Remember the chef who's putting his finger in his nose, giving you food poisoning because of the enterotoxins, because staph colonized his nasopharynx. Diseases caused by Staph aureus are many. Here's just a short list. Skin infections, impetigo, abscess, furuncle, carbuncle, folliculitis, you name it. Staph scalded skin syndrome for babies, toxic shock syndrome, food poisoning, pneumonia, osteomyelitis, and others. We shall talk about them in the next video. Pause and review. Let's review the characteristics of Staph aureus from Picmonic. Staph aureus. Here is a staph. Here is Oreo. It's a gram-positive. When it's a gram-positive, Picmonic will draw an angel for you. Okay. Coccus. Cocked eyes. Cocci are spherical, as you see. Catalase positive. Here is a positive cat. Coagulase positive. Here is a positive clog. I will end up with staph clogging a piece of my skin. Tiny piece, like a folliculitis. Staphylococcus protein A arrests your antibody, therefore it's a virulence factor. It inhibits phagocytes. Some Staph aureus are sensitive to methicillin. Others are resistant to methicillin, and they are called MRSA, methicillin-resistant Staph aureus. We'll talk about them in the next video. These horrible bacteria are resistant to many antibiotics. Medicosis pearls for the pros. Physiologically, your spleen contains splenic macrophages. Their function is to remove encapsulated organisms from your body. Oh, it's a defense mechanism. That's true. But pathologically, what if I have asplenia? Why do you have asplenia medicosis? Maybe I removed my spleen via surgery, splenectomy. Maybe my spleen is infarcted. Maybe I destroyed the spleen because I have a disease. So even though my spleen exists anatomically, it is useless functionally. This is called autosplenectomy. This can happen in sickle cell disease, for example, among others. If I have asplenia, what's going to happen? Increased risk of infections. With what? with encapsulated organisms, including staph, including staph, and including the famous shin, as we have discussed before. Please do not confuse Haemophilus influenzae bacteria with the influenza virus. Big difference. Another clinical pearl, the antibiotic polymyxin. Do you know how it works? Yeah. It adds pores and puncture holes into the membrane of the bacteria, usually the gram-negative bacteria. Osmotic damage is going to destroy the bacteria because one of the functions of the cell membrane was what? Oh, to protect the bacteria from osmotic damage. But when I damage it, what's going to happen? Osmotic damage to the bacteria. Go to hell. That was the good news. But since there are no solutions in life, there are only trade-offs. Polymyxin has trade-offs. This osmotic damage is good news when you're destroying the bacteria. It's bad news when it's destroying your tissue. Neurotoxic, nephrotoxic. How? It keeps puncturing holes and pores, polypores, inside your organs. That's why we do not use it systemically, we use it topically. This was just a hint of my premium antibiotics course, which you can download on my website, medicosisperfectionalis.com. Learn about antimicrobials, antivirals, antifungals, and antiparasitic medications in 40 beautiful videos with tables, charts, questions, cases, answers, etc. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my premium antibiotics course. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense. See ya.